Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome to Research Perch. I'm Michael Reynolds, the chair for the marketing committee for the Massage Therapy Foundation, and we're glad you're here with Nikki Monk and Ruth Warner. Ruth is joining us from her beautiful home in Oregon, and Nikki is joining us from her office in Indianapolis. How are you both?
Beautiful office.
It is a beautiful office. Very, very nicely organized too, and lots of books behind her. I like to see that. All right. So, as you know, if you've joined us before, Research Perch is here to discuss massage therapy research, as the name implies, and we take articles from the International Journal of Therapeutic Massage and Bodywork and unpack them for you, the professional massage therapist, so you can get a sense of how massage therapy research helps you in your practice and your clients and patients as well. So again, so happy you've joined us today. So let's get started. So today we are talking about an article here called Assessing the Effectiveness of Massage Therapy for Bilateral Cleft Lip Reconstruction Scars. So who would like to set us up first by just kind of defining bilateral cleft lip reconstruction and what that means?
I can do that a little bit at least.
Thanks, Ruth.
Good. That's the only reason you people keep me around. So our listeners may be aware that a cleft lip is what happens when there's a birth defect and sections of the skin and musculature and connective tissues of the face don't completely join. And they can be quite mild and just have a little divot, or they can be really severe and go up into the sinuses too. We don't see a lot of people with unrepaired cleft lips in North America because, we live with healthcare systems, functional or not, that generally get kids into surgery for this. That's not true around the world, but at least here, someone who's born with a cleft lip is very likely to undergo surgery or a series of surgeries to repair the cleft lip, which is not just for aesthetics, but also for function, because if a young child can't speak to imitate the speech that he hears, then very often they end up with, really a lot of accompanying learning disabilities. I mean, learning how to speak is a big part of learning how to communicate, learning how to read, and learning how to communicate all together. So the subject of this case report was a young man. I don't remember how old he was, in his early 20s, maybe.
Yeah, 19.
Okay, yeah, who had cleft lip surgery in his childhood, and that was satisfactory, but it left him with a long-term issue with a lot of scar tissue and lack of movement in his lip. And as a young man, he thought that he would like to have less of a feeling of restriction and more freedom of movement to just help with his sense of comfort, his sense of self-acceptance, his clarity of his speech. And so pursued that through receiving massage. And the massage therapist who had this client took advantage of the opportunity that we now have a decent body of evidence about massage therapy and scar tissue, including, long-term, decades-old scar tissue like this fellow had. And she did some really lovely work, not only with designing a strategy to help this young man with his goals, but with designing ways to track progress.
Yes, she did some really interesting ways of doing that.
It was really lovely. So this is a case report. So it's an N of one. Well, it's not even an N of one. It's one therapist and one client who are working together to achieve these goals. And then this therapist wrote up the description of the process and results and submitted it to the Foundation's case report contest. And if I remember correctly, I think this was a gold winner.
It should be in the acknowledgments. Let me look really fast.
Yeah,
I think it was as well.
I just read them and take notes. So.
Yeah. Oh, it doesn't. Well, it is in here. I think you're right, though. I think she was.
I think this was a gold winner. And in fact, if I have it right, we may meet her in Denver. if I'm pretty sure this is one who we've invited to come
I
speak
hope
to
so.
us.
Oh, I hope so. I'd really like to meet her. Yes, Emily McKay.
McKay, right.
Mm-hmm,
Right.
mm-hmm. Yeah.
So we liked this case report because she gave us everything that's necessary in a case report, but she did it in a way that we felt was really imaginative and incredibly client-centered, and that's a really important part of case reports, is that really you're working with a person who has their specific goals. It's less about being able to bend your knee to 90 degrees and more about being able to climb the stairs, right? This is the difference between a clinical outcome and a functional one. What this client wanted was to feel less restriction in his lip and have more freedom of movement, which was difficult to measure, but the therapist came up with a really interesting way.
Well, she did. And so she did a couple of things. She had some subjective pieces. One of the things that she wanted to measure was this young man's acceptance of his scar and his features. And then, let's see, because there were two of them. It was the appearance scale, so how... All right, so right, and then the other one was restrictive, right? So, how restrictive is it, and then how do you feel about the appearance? So she developed a very easy Likert type scale for that, and then she also took pictures of first just the scar and the mouth at rest, and then with
no eyes, so we have anonymity.
Right. Mm-hmm. And then there's two pieces that are really defined with cleft palate reconstructive scarring, and that is that the asymmetry of the smile is affected, and so there it is, the movement there, and then also the puckering of the lips. And so she took pictures of these three stages, so at rest, with the smile, and with the pucker. But then there's this other piece too, that how do you measure the strength of a muscle? And that was one of the things in this restrictive piece. How do you measure that? And so she devised a really clever way to do this, and that was by taking a pen and putting it in.
Can you do it? Can you do it? I can't do it.
Oh yeah, well, I did it for a long time earlier today, and I was like, oh wow, I could see where this would be really tiring. But putting the pen at the top of the lip and then holding it with your upper lip to your nose. Mm-hmm. And so she did that and timed it. And so when he came in for the first time, he couldn't do it at all. And then she timed it each time that he came in. And so we ought to say too that it was a series of 5 treatments, and those treatments were 75 minutes long. So this includes all the intake and all of those pieces. So we don't exactly know exactly how much contact time, but we can very easily assume at least 60 minutes, if not more. She does a really nice job in this case report of documenting her approach. She did a really great table that outlined what the technique was, the area that technique was applied. So it was applied to the outside of the cheek, addressing the muscles, but then also on the inside of the mouth to address the scar tissue. Mm-hmm. And then she also did the head and neck area. So she was doing all of the upper shoulder, head, face area. And then she also says what the intent of each of those techniques were. It's a wonderful, wonderful table that she's put together that can be used as a guide for other case reports. But this measuring with the pen was a really clever way to get at this strengthening. And by the end of these 5 sessions, he was actually able to hold the pen for 15 seconds, and they finally just said stop. I mean, it was plenty of time, and it got gradually better. It started off at 0, then it went to 2 seconds, then it went to, can I get it fast enough? 3 seconds, then 4 seconds, then 8 seconds, and then after the last treatment, came back, did the measures again, 15 seconds plus. So really significant difference. And I think the other meaningful pieces here was that the young man was saying that his confidence was much better, his acceptance of the scar was much better at the end of all of this, and that he felt less restriction. So here again, really client-centered outcomes that had meaningful change for this young man.
That's really a creative method of measurement. I like the way you describe that. And if I could just go on a quick little very tiny rabbit hole here, I'll come right back, I promise. But I had no idea that if you're conducting a case report that you could make up your own methods of measuring results. So, she took this pen and made this really creative way of measuring, or of creating a measure, and I didn't realize that was possible. So that's pretty interesting.
Certainly, well, and one of the things that she even says that's kind of a call in her discussion of, could this technique be validated? If so, somebody ought to validate it.
Yeah, I just assumed there were these, rigid rules that everybody had to
about
follow, but
Yeah.
very cool.
Yeah,
Very cool.
I do want to talk about that a little bit, Michael, because what we would like to discourage is people making up their own measuring tools.
Okay.
So all
Sorry, I
that
brought
being
that
said,
up then.
If something exists to get after the data that you're looking for, you should go with something that, with some kind of tool that's been validated.
Sure, don't reinvent the wheel.
Right.
As this therapist said, I don't know how valid this tool is. Seemed like a good idea. I would love for more people with cleft palate to experiment with this, right? To see if it, if it's a good way to track improvement. And this does happen in case reports, and it's appropriate up to a point, but we don't want people throwing out already well-validated scores.
Absolutely.
Yeah, that's a good caution.
They come up with their own.
And I think that there's, she was really getting at a very specific thing, strengthening of this particular muscle. What is this muscle's action? And this is a practical way to do that without sort of, I don't know, is there a dynamometer for facial muscles? I don't know the answer to that. There is for, some of the bigger muscles, certainly, but I don't know about that. But then there's also this notion of what is meaningful to the client. And now, granted, is it really important for somebody to be able to hold a pen in their lip? No, but what it translates to is his ability to smile and talk and not feel that fatigue in his mouth region, which is one of the things that he did. But there's also some other measures that can be used. I can't come up with it in this moment, but I know that we'll talk about it in another case report another time. But there's a measure your own outcomes measure that the client is able to identify, this is the thing that I want to have change in. So say, for instance, you have somebody who wants to be able to play with their grandkids without feeling so fatigued. That can be their client-centered outcome measure. Now, the practitioner could still measure some other things like range of motion or things like that, but this sort of approach would be something that was very clinically meaningful, so a patient-centered outcome, which is a kind of a catchphrase that's being used in research right now. Patient-centered outcomes are very, very important, certainly with the Pecori Institute, which is looking at that very thing. But that's a whole nother rabbit hole.
But who's in a better position to be focused on patient-centered outcomes than people who get to spend an hour with them totally focused
Right. Well, and the patient themselves, where they can identify, this is something that's meaningful to me, and this is where I want to see my change. Right.
So this is a great way that massage therapists can play to their strengths.
Yeah.
Another thing I want to bring up before we have to wrap this one up is about the self-acceptance piece. So here's a person who has what he considers and what most people would consider to be a defect, right? This scarring and this asymmetrical smile and whatever, and through the massage and through actually focusing on the part of his body that might be considered really problematic, somehow at the end of that he came out feeling much better about himself and about his appearance and his sort of his place in the world. And I just want to really put out that massage therapy is in a position to do that in a lot of different contexts. That the one of the qualities of the client-therapist relationship is this trust that we allow when we allow someone to touch us in a way that might be really, really deeply meaningful and deeply frightening for other people. And really where I'm getting at here is abdominal massage. So many of us avoid abdominal massage because we're self-conscious about our bellies, and we don't want anyone to see, and we don't want anyone to touch. But the truth is, when we incorporate all of our body, what does that mean? It means weave the body, the corpore, together. Massage therapy is a wonderful incorporator to weave us together into a beloved whole. And I know it's not scientific, and I know it's probably as woo-woo as I get, but I think I think it's critical. I think it's absolutely essential that massage therapists have this role of helping people love their bodies.
And that's exactly what happened here. I mean, what happened here?
She does a really nice job with that.
Yeah, restrictions were decreased and confidence was increased. So you've got both kind of aspects of the mental well-being and the physical well-being kind of combined and integrated into this particular situation here, which I really like.
Well, and one of the things that she does too is she makes some suggestion for future work informed by this. So this is a young man who was 19 years old and had these sorts of results with this long of scar tissue development and existence. What about with children who are even younger? If those sorts of pieces were integrated earlier on, could that help with their confidence moving through? Could it help with their developmental pieces and things like that? And my mind goes to the accessibility piece. And when I think of cleft palate reconstruction surgery, I'm constantly reminded and thinking of the different charitable organizations who go into the underserved populations and in the countries where the healthcare isn't available for these young people. And is this a technique that could be taught to parents or to be taught to care providers there, that they could easily do these sorts of things and break down some of the barrier issues that certainly does exist in this country with massage therapy, with it not being covered and things like that. But my mind goes to that place. How can we take this even further?
Yeah, this does spark a lot more. Yeah,
it was
I would agree.
very well done case report. Certainly meaningful results, and also, as Ruth points out, touches on some of the essence of what massage practice can do in that. What was the word that you used? Incorporating?
Yeah.
Yeah, incorporating this.
Yeah, you bet.
Massage does. Yeah. Beautifully stated, Ruth.
Agreed. And I mean, we've already basically kind of talked through this, but the author does conclude that the evidence suggests that massage therapy did help with the impairments associated with scars formed by bilateral cleft lip reconstruction. So it's a pretty positive outcome there. So it's nice to see something that specific, and I really enjoyed this one as well. So thank you both. So great discussion today. Really appreciate your time as always. So we'll go ahead and wrap up there. But again, to our audience who's listening and watching, thank you so much. We really appreciate you joining us for Research Perch. This is our 10th episode, I believe. So quite a milestone there. So we've got some momentum going, and our audience is growing every single episode. So if you're listening, we really appreciate it. Obviously, you can find us online at massagetherapyfoundation.org. Subscribe to our blog, grab our resources. They're there to help you. And if you're watching, please feel free to subscribe below as well, and you can take this with you on your smartphone. So again, these articles come from the International Journal of Therapeutic Massage and Bodywork at ijtmb.org. So we would love it if you would go there and subscribe. So Nikki, Ruth, thank you again. Pleasure speaking with you as always. And thanks everyone for joining us. We really appreciate you being here, and we'll see you next time.
See you next time.
Bye-bye.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.